Okay, I'll call to order our meeting. This is a public hearing for the budget, the 2019-2020 budget. And I guess the first order of business is, Brian, is that?
Thank you, Mr. Chairman.
Okay.
Unless you need the presentation given from Monday again, I would say that you can just open it up to the public hearing. I don't have anything to add.
Okay. Okay, we'll open it up for public comment at this time, and I don't have anyone signed up, but does anyone want to speak to the budget? Did you want to speak? Okay.
Come on.
This might be real quick. Okay. Would you like to speak, Mr. Ben? Okay. Okay.
What about Mr. Carr? He's coming in.
Okay.
Might as well ask
Maybe
him.
you ought to give us a small visit. Can you give a small?
Mr. Carr just came in.
Yeah.
Give us a 30-minute one anyway.
Hey, Ted, would you like to speak in the hearing? Would you like to speak? Okay. Okay. I think we ought to do something.
Whatever y'all want to do. Maybe Brian, are you prepared to do a short synopsis of it, just for?
And as I explained to the chair and to the manager, I have a previously scheduled engagement that's going to take me out since we don't have any other matters coming up from the public on this. You could keep your own questions, to yourself until we get another time. Or not. If you have a question that you need legal advice on right now, you've got 10 minutes. Okay? Okay. Okay.
Right.
Did anyone speak Monday at the?
No. We've not had any public comment.
Has anybody had any comments on the budget at all that they've received?
I haven't received none. None.
I haven't either. I just. Well, when nobody shows up, generally you're doing okay.
We hope so.
That or they give up on you one.
Who what?
Either that or they give up on you one.
Yeah, I was going to say that we need probably in the technology budget, you need to add some speed.
I'll go through this few slides here. So this is the budget we presented on Monday. From a revenue perspective, property taxes increasing about $822,000. This is broken out by real, personal, and utility tax. Expected to increase $350,821. Vehicle tax is up quite a bit more, $471,754. Represents an increase overall of 1.88% in property tax. And by the way, it keeps the tax rate level at 58.5 cents. The collection rate that we have to use did see a slight drop from fiscal year 17 to 18, but current year, our collection rate is about 99.27% of budget. So next year when I give this presentation, we should have a little bit higher collection rate to budget for us. It's good news. Sales tax is increasing $727,000. This is an increase of 4.73%. Always, sales tax is more volatile than property tax, subject to the market conditions, but we feel like this is a good estimate, and it's continuing to outperform for current year. All other revenue, this is a catch-all for everything else that we generate. It's going to increase about $1.4 million for next year. Two of the biggest drivers are associated with EMS. We started the convalescent program, so we have $718,000 in for next year's budget, and we have changed our percentage that we give the billing company. And also, we started the health data exchange program with the hospital. Both of those together should net us about $495,000 more in revenue. So that's great news. Investment earnings up $290,000. We have more cash in the bank, and we're making investments that pay a higher interest rate. So that's good news. And after the work session on the 6th, we got notice from the Friends of the Haywood County Animal Shelter that they're going to give us $200,000 towards our debt payments on the Animal Services building. So that was a great bit of news that helped bring down the amount of fund balance we have to use.
That's great.
Not all the revenues are up. We have a decrease in that category called restricted intergovernmental. Those are really funds from the state and federal government. Overall, those are going to drop about $305,000, namely foster care, Medicaid transportation, and funds we get in the clinical side of the health department. So, any questions on the revenue side?
As far as that reduction in revenue, does that mean we get to reduce services too, or continue services at the same
We're
level?
going to continue service. Some services will decrease, but it's mainly a hit to the county.
Okay.
So overall revenues are up when you control for fund balance, $3,014,000, an increase of 3.73% in general fund revenues. On the function side, the general fund on the expenditure side is $4.8 million increase. If you look at it along the categories, public safety is up $1.8 million, human services is up $1,054,000, and education $881,000. The others you can see there, but those are the top three. What's interesting is that when you control for our health plan costs, the total budget is actually up $2,054,000, not $4.8 million. And when you control for that health insurance or health plan number, education becomes the biggest category of $881,000, then public safety of $863,000, and then economic and physical development at $246,000. Questions on expenditures by function?
Just on the health plan, Bryant, what are we doing to help with the health plan? You'd hired a consultant, or rather we have a consultant.
I have a slide on that.
Oh, okay, just wait till you get to it.
And I'll get right to that. If we get away from functions, but we look in categories, salaries and benefits are the largest increase. Remember, general fund's up $4.8 million, salaries and benefits are up $4.53. So, and what's driving that is the health plan costs, almost $2.8 million in active and retiree employee insurance. Also, we have over 14 positions requested. This budget includes 10.25 in the general fund. We have mandated cost increases to the retirement plan. The state changed the employer contribution rate, so we had an increase in that. All local governments did, and I think that was about $340,000. We have the structured market increases in there. On the 6th, the board approved the convalescent program, so we have 6 EMS positions in there. And outside of the general fund, we have 2 solid waste clerk positions to work the scale house. The general fund positions are the half-time CMA at the healthcare clinic or at our wellness clinic. We have the IT position. It's a software support position. This position, we currently have 1 with no backup. This is a plan that IT's been working on for a while to have some backup if that employee's sick. or hits the Powerball and moves away, we'll have somebody else there that can to take over. The sheriff's office, we have a lieutenant that will be posted for night watch. Evidence room clerk or evidence room officer goes from 3/4 time to full time, and we have a detention sergeant. Currently, 3 of the 4 squads are supervised by the sergeant. This will make sure that all 4 squads are supervised by a sergeant. Environmental health is a position that will do sewer and well permits as well as restaurant inspections. We're required every year to inspect all restaurants, so as the county's grown, we need to add another position to ensure that we comply with state statute. DSS, we've got 3 positions, 2 income maintenance workers. This is eligibility workers for food stamps and Medicaid. The social worker 3 position will be assigned to adult protective services. Back during our planning session in the winter, I showed you a slide of the APS calls that we've had, and they're just growing. So this will help get our caseloads back down to more manageable levels. Cooperative Extension is an FCS agent that we've currently, for the last few years, we've shared with Macon County. This would bring that position to Haywood County by itself. While we would have to increase our funding, the state is increasing their funding as well. So that will allow them to provide more services or more education services in our schools and community. Animal services, we've got the 4 part-time shelter positions. This one is really beneficial because currently our officers, field officers, are spending a great deal of their time inside the shelter cleaning, things like that. And so calls go unanswered. By freeing this up, by bringing these part-time people in to work in the shelter, our officers can be out in the field responding more timely to calls more timely. And also the 6 positions for EMS are listed there. Questions on the positions? Okay. Our 2%, the budget includes a 2% cost of living. That would be effective the first full pay period in July. That's for all employees. The market adjustments, we pushed out until after the first of the year. They would take effect after the first full pay period in January. And it's a differential market adjustment. Be for those under $40,000 in base salary would receive a 5% increase. Those making between 40 and 60 would get a 3% increase, and over 60,000 would receive a 1.5% increase. So the 5% adjustment impacts 308 total positions. You can see, that is about 62% of all of our positions. About 80% of all these positions receiving the 5% are either in public safety or human services. As a footnote, 101 of the 308 positions actually have a base salary of under $30,000. So this actually is giving more to those that need it the most. These are the positions that were the furthest off from market, and we have the highest turnover, and they're also the positions we have a harder time recruiting. 3% market adjustment impacts 146 total positions, 29% of our total positions. 76% of these work in public safety or human services. Of the 146, 102 have a base salary under $50,000. The 1.5% market adjustment impacts 46 total positions, or about 9% of our positions. These are our highest earners. They're the closest to the market, and we don't have that hard of a time recruiting those. The current year, we did a 2% merit, 1% COLA, and increased the 401k. So total for these folks would be a 2% COLA and 1.5% market. It's very close in line with what we did this year across the board. What's the impact? Current year, the compensation plan costs about $1,147,000. Next year, we're able to do this differential market adjustment for $1.25 million, an increase of $105,000. We're really hoping that it saves money by decreasing turnover and we actually, like I said earlier, helps employees who need it most and helps in our recruiting. Any questions about that? Just one second. I'm sorry, my notes got out of line since since Monday. Back up just one second. Okay. So with this, what you were saying, Mr. Chairman, was we have hired a consultant to come in and review not only our claims, but the discounts that we receive with Crescent. We've been with Crescent for a long time. They do a great job for us. But with any rising costs, you have to kind of look at see if we have the best plan for the county. So in July, we plan on bidding out the plan to see how the numbers look. But also, there's some tough decisions ahead of us. We know that we may have to look how we handle retiree benefits for those that are hired after the first of the year, not impacting current employees, but those that we may hire in January or something like that. The plan is just growing to where we really need to have those as options. We also may have to look at limiting the plan. Right now we have a PPO plan and the HSA plan. We may have to think about limiting new hires to just the HSA plan. And also, and I think this is the most important, is create a wellness initiative. We've got the clinic, and they saw over 2,400 patients last year. That's our employees and dependents. But we still are faced with increases of over 18% a year. And so we have to look at ways to get our employees healthier. That will lower our costs, but it also adds to their, quality of life. It makes them better employees, better service to the public. Any questions on that? Okay. Get back over to another category is operating. Our total operating is up $1,046,000 in the general fund. But out of the $1,046,000, and I'm sorry, the $1,046,000 represents about a 2.85% increase in operating. But of the $1,046,000, $881,000 of it is associated with funding for the school system and the college. You can see we have an increase of $57,000 for the community college in capital. We have $178,000 increase in college operating. You may remember the college request was about $493,000, but over $300,000 was associated with janitorial services. Well, the bids came in a lot less than what they had planned on, so the $178,000 that we are giving the college next year, 6.5% increase, will cover their needs. The school capital increase of $150,000 and school operating an increase of $496,000. Any questions on education? On the county side, operating, like I said, when you control for the schools, county operating is increasing $164,000 or 0.97%. That's a pretty tight operating increase. The big things that we have are funds for the revow. We also have an increase. While it's offset by revenue, the TDA funds come through our general fund, so it's an $187,000 increase. It's offset by revenue. Mountain projects, we have $141,000 in carryover funds for transportation. Those funds originated a couple of years ago, and we just carry them over from one year to the next. Cooperative extension, I'll mention that position on the salaries and benefits side, new positions. For us, the way we pay the NC State for the position, it's really an operating cost. And we also have $50,000 in for a pay plan classification study. It's been at least 10 years, maybe 20 years since we've done a classification study to make sure that the positions we have are classified right internally as well as comparing to other counties. Any questions on operating? Okay. On the capital side, capital and capital outlay, it's a decrease of $856,000. A lot of that's associated with voting machines. The last 2 years, we've budgeted $800,000 a year for replacement of machines. We still don't have certified machines that meet all of our needs from the state. Doesn't look like that will come through in fiscal year 20. So we aren't budgeting those funds. If the state does certify machines and we don't get the extension that we asked the state for, we'll probably have to come back and ask for an appropriation of fund balance. But right now, I didn't see a reason to tie up $800,000. Vehicles, we're going to replace 17 vehicles, $1.1 million. 10 are for the sheriff, 3 for EMS. One of those for EMS is a remount, and one of them is the new vehicle for the convalescent program. Environmental health is going to get 2 trucks. HSA will get an SUV to split between the health and DSS side, and the fire marshal is a replacement truck. Questions on vehicles? Okay. Other capital items, we have $165,000 for a body scanner for the detention center. The cost is really about $190,000, but the sheriff has some funds from drug forfeiture and the Ross Trust that he's going to pitch in to lower our costs. Facilities, we have the $151,000 for the paving of Paragon, and we also have $263,000 for building maintenance. That's roofing projects, lighting projects, all sorts of things that facilities handles. And IT, we have $242,000 for replacement equipment. That's equipment that is at the end of its useful life. It's not supported any longer. And then while it's on the capital side, we really have debt funds payments in there for $161,000 for a new radio tower and equipment to help fix radio problems that we've had in the county for quite some time. So that's actually about $1.3 million, but we have the $161 for debt payments.
That's mostly the southern end of the county too, isn't it? Right, with radio tower.
It is, but it's across the county.
Is it?
I mean,
Okay.
it's,
It'll really help
all
the
departments
southern
complain to a certain extent, but the most complaints come from the south end.
Okay.
Sorry.
No. So there is a shortfall, $3.6 million worth of fund balance appropriated to balance. It's a little bit higher than the current year. We used $1.8 million in the adopted budget for FY19. And you should really make sure you don't budget fund balance for recurring costs, but with the problem that the health plan has presented, it's really a struggle to find ways to cut our way out of this. There's about $1.8 million of reductions from what was requested to what we actually have in the recommended budget. We're healthy financially, and I think we can make some plan design changes and do some wellness initiatives to get that health insurance number down. So maybe all the $3.6 million that we use in fund balance won't be used by June 30th of 2020. Any questions?
I don't have any questions. I want to commend you for, one, a good budget presentation. Two, I appreciate you taking consideration for the employees, and I think the entire board did as far as the market adjustments, especially the 5% increase for the lower pay. I think that will help on retention and turnover.
That was your all's direction at the planning session in the winter, was to find a way to take care of those employees. And I don't remember the numbers exactly. It was somewhere between 13,000 and 17,000 every time we lose a paramedic or someone in the jail. And we've got to stop that. So are you going to pay it on the front end or the back end? And I hope this plan works. We really need to track our turnover. Not everybody leaves for money, but we've got enough data to know that people are leaving for money in many cases. So.
All right. And I think we really need to pursue the wellness initiative to help with the health insurance. I think if we keep our employees healthy and active, that we'll probably spend less on our insurance. And hopefully find more people interested in insuring us.
Yeah, the increases we're having, we're not alone. Other counties are having this, and the state itself is having problems. But there are places that actually are holding their own or having decreases because their employees are getting healthier. So there are proven ways to get there, and we're going to try it this year. So.
All right. Thank you.
Anybody else have anything? I know Bryant, you've gone through this, and I know you've asked us for questions, but we've had 6 or 7 meetings where we've asked you questions and a lot of phone calls going back and forth. So
You ought to have that presentation memorized by now, Brian.
yeah. But I appreciate your budget and Julie, y'all, Julie's staff and everyone that's worked on it. And it seems like it's been really seamless. I think. I haven't had any questions really about it and stuff. So I think if we do have questions, we explain it, and it's self-explanatory. So.
One thing noteworthy on your budget was the $200,000 that the Friends of the Animal Shelter came forward with. This is a animal advocacy group that's concerned about animal welfare, but they kind of put money behind their mouth. And that's always nice to hear a group that's concerned about it, but they come forward with $200,000. To put on the animal shelter, which of course they fulfill in the pledge. But, I think this group's diplomatic and they see both sides of the issues and they're diplomatic and credible, and they're willing to work with people for common solutions in a very good way. So I appreciate that $200,000 if anybody's out there listening.
You think, Brandon?
Oh, I'm good.
Mark,
I've made comments before.
Yeah.
To other meetings, and appreciate the staff and time involved. I think Kevin said it last time. They've been working on it since January, so it's been quite some time that we've been working on the budget. So just thank you for what you've done.
Yeah, thank you.
And then Mark had a good idea about expanding the wellness clinic a little bit last time, Kirk. About maybe expanding some hours on it, because then our people can go there instead of going to urgent care or something like that. So I think Brian's going to look into that. Go ahead.
That's right. The figures are, we spend about $106 per visit at the wellness clinic. I think it's about $320 for urgent care. It's closer to $1,500 for an ER visit, and just a regular family doc is about $140. So the wellness clinic saves us money, and if we can find ways to expand the hours, and I think that CMA position will really benefit us. You don't have to have a lot of visits there to pay for a part-time position. So I think it's an approach that can save us some too. Health insurance keeps going up, so even if you don't see a decrease, but you just slow the growth, that would be a win for us over the last couple of years.
I don't know if you guys recall, but I had asked Ms. Shupin, I think back in a work session, if extending hours or working more hours, kind of laughed about it at the time, but I'd had a couple of the employees that contacted me and said that they would like to do that, that they would go, as Mark mentioned, if they were open more hours. So maybe something we need to look at.
Yeah, something.
No, I think you covered it.
So tonight's the public hearing on June 3rd. You'll consider the budget, but I also want to mention we have the budget book in the clerk's office and in finance that can be viewed. It's on our website. We also have a copy at the main library. So if anybody wants to see the budget, it's out there in several, and his phone. He's allowing you to look at it on his phone. So.
Are you done? Are you finished? Right.
Yes, sir.
I'll go ahead and ask for public comment since they've heard the presentation, and if that's okay. Sure. Okay. You can just come up here. We're televising this, so if you'll give your name and address, maybe where you're from, and you've got 3 minutes.
Okay, it's more of a clarifying question. Okay, so David Hooten, I live at 55 Laurel Ridge North, Maggie Valley, North Carolina, 28751-9709. So on the wellness, when you're talking about public, the employees going through wellness, what particular stipulations do we have when you define wellness? For instance, I come from a large corporation. We get health care credits to offset costs. but you have to prove that you have so many hours of exercise, so many days a week, so what, my clarifying question is, when you speak of wellness, which I appreciate the fact, what does that entail on a high level? I know we can dig into it. Go ahead.
Some of the things we're talking about, and activity is certainly the right direction. We lack doing a required yearly health risk assessment where people have blood draws to where they're checking their sugar levels, their triglycerides, their cholesterol. So I want to start there, and if you look at our claims, we've got high claims in diabetes and heart disease. Those things, if we catch them on the front end, it's much cheaper to treat them on the front end than afterwards. So those things will be right up front.
Well, good. I'm 34 years with Fiat Chrysler Automobiles, so we were self-insured, so nobody was funding us.
Yeah, we are too.
Per se. So when we had to go through it, we had two stipulations. You had to have an annual health care assessment done by your physician, and then in order to get credits, in other words, healthier people got certain credits to offset costs. So the difference is you can either raise costs on everybody or you can give credits to people who are healthy. So what we had to prove was exercise. What do you do for diet? And we had a counselor that was able to ask questions, and in order to get those credits, you had to qualify for those. If you didn't get the credits. So it cost you more in any given year if you lived a less healthy lifestyle. Okay, I like to say popping chips, right? And no exercise. It cost you more for your health care because you didn't get the credits to offset it. And I don't know what the county's looking at, but it's a good way to do it. You know, you might get $450 to $800 worth of credits in any given year, but you had to prove that. And we've got good health centers here. We use them.
Yeah, thank you. Yeah, thank you for that. And we're going to start doing that. So in some form. Ted, did you want to say something?
Just take those. In my 3 minutes, I'm just going to ask questions and not take time to respond. Thank you very much for having this public forum. On the Haywood County school system, is the school system satisfied with the budget you have? That's question number one. I didn't hear anything addressing the Haywood County, the college health care facility, the nursing facility, $7 million or something like that. So how's that addressed in the budget? And thank you for the radio tower. And I see Greg left, but he knows well that the radio in south of the county is totally inadequate. So is that addressed under the radio, $162,000 there? The classification study, $50,000. Seemed like you could just send over to Jackson County and to Buncombe County, and how much are you paying your folks over there? And somebody on a couple of days could look at that and see if we're compatible without spending $50,000 for that. A restaurant inspector, how hard do you say the ones that you've got, let them work a little faster, not spend so much time at the restaurant rather than hire a new one? And questions on health insurance. I understand we have a facility that they can go to that's like urgent care, and that takes care of that, but they have to go to the doctors. And I don't think, Julie, the doctors send you the bill. So there's some administration company that deals with that. And do they negotiate rates for x-rays and for doctors and their specialties? And what makes me think of that is United Healthcare negotiating here with our facility and how long that took to get that resolved. So the company that administers the compensation, the payments, how hard do they negotiate? Thank you very much, gentlemen.
Thank you, Ted. Did you want to comment on this one? Yeah.
Yeah, I can't answer if the schools are satisfied or not. The budget that I recommended is what the school system requested. So, that they probably would have liked to ask for more. So, completely satisfied, but we're funding what they requested. So they've got to be fairly happy, I would say. The nursing facility, because of the timing, it's such a large construction project, and there's going to require a debt instrument. The college has not selected an architect or signed a contract. They have state bond money to where they can go ahead and contract with that architect, but sometimes the design work will take a year. So it's not a 20 consideration just because we don't know if we will have to make any payments in fiscal year 20. So as we get closer and work with the college, we'll know better and take action sometime after the first of the year. If nothing in this budget, and we don't think that there will be any requirement in this budget because they have money to get started. The classification study, I wish it was as easy as Colin Jackson because it would make our lives easier, but a true oranges to oranges or apples to apples comparison is tough, especially when you're dealing with 6 or 7 counties and what we require of an administrative assistant one and what Transylvania or Henderson may require or classify those as. There's no consistency, so you actually get people with expertise to do this study to go in and vet it. And it's an extensive project, and there's very few firms, but we just don't have the expertise, and you don't do it every year, so you don't need to staff accordingly. So it's cheaper in the long run to pay someone to do one every 10 or 15 years, whatever that number of years is determined. But since it's been closer to 20 for us, I think we probably need to take a hard look at it, but that won't be something we need to do in the next 5 to 7 once it's done this year. So the tower and the equipment is about $1.3 million. We have $161,000 in for debt payments. We're going to finance that, and so the tower's in there. Is that for the south end of the county? That's my understanding.
It is. It's actually for the entire county. We're looking at a piece of property that is going to take care of the problems all across the county, and it should take care of the south end. We don't know for sure. We've got an engineer looking at it now, but if it don't, we're going to definitely take care of the problem. So to make you happy, we're going to take care of it either way.
If I may respond to Mr. Carr, I'm sure you're aware of the Health and Human Services, the Haywood County Nursing Facility. They had a $2.8 million grant, even though they said there wasn't a sunset on it. They're moving up on 6 years, and the state said they'd like to see that money put to use, even though they said there wasn't a sunset. But that $4.4 million shortfall, I'm sure if you read the local newspaper, the Haywood Hospital Foundation, they came through big for us on that, and give them some kudos. But also on that classification, I had the same question with Mr. Moorhead, and it has been so many years that there has been a true study done. As he said, it's not something that's going to show up very frequently on the budget and be years apart, but felt like, in talking to Mr. Moorhead, I felt like that was a justified expenditure.
Okay, is any other comments? Okay, we'll be voting on the budget on June the 3rd. We'll consider adopting it on June the 3rd. So if anybody has any comments, or you can email us, or
Yes.
Yeah, right. And the budget is on the website, so you can look at. Oh yeah, right. Yeah, that would be fine. So, okay. So does anybody else have anything?
Nope.
Okay, if not, I appreciate everybody coming out, and I'll have a motion to adjourn.
So moved.
Second. All in favor, indicate by saying aye. Aye. Okay, we're adjourned.